Good afternoon, everyone. At the onset, I would like to thank AIOC and Thinking Under the Apple Tree giving me the opportunity to present my innovation, Lab on Chip, a new dimension in ocular surface diagnosis. So I have no financial disclosures. To begin with, what did COVID-19 teach us in the past 1 year? It taught us the power of rapid diagnosis, it taught us the power of immunology, and it taught us how to modulate to control the disease. And this led us to think that there is a lot happening in our body for which we need to use this knowledge gap to personalize the medicine according to the changes occurring in our body. So where is the knowledge gap in our daily practice of refractive surgery? It is in post-LASIK ectasia, the occurrence of scar or haze after mitomycin C, neuropathic pain which can't be explained, dry eye disease which is not improving with treatment. So these knowledge gaps led us to thinking about the molecules which are present in our eye. So there are increased inflammatory cells, there is LOX and collagen. So what all these cells and the LOX and collagen help us and determine is our wound healing, our haze after surgery, the ectasia. So all these molecular markers influence the surgical outcomes and response to therapy. So it is vital for us to know what we are dealing with. So we come to a research question that like we have our COVID-19 RT-PCR kit, the pregnancy kit and the glucometer kit. So can we have a point of care diagnostic kit to diagnose these ocular changes? So we came to the factor now that we have to pick the right markers. So the international groups, various studies have told us, and our own study group at Narayan Nethralaya has told us that a lot of things like increased ocular discomfort, inflammation, neuropathic pain, degradation of collagen is rotated by these molecular markers. So we took this potpourri of markers and helped in building a kit. So the kit is based on the principle of like the ELISA multiplex fluorescence based antigen antibody reaction. So the antibody is lined in the wells of the kit, if you can see here, and the antigen comes from the tear cytokines. There is also second antibody, which acts like a fluorescent marker to detect in the fluorescence of the ELISA multiplex system. So the cartridge is designed as a multi-fluidic drainage kit with multiple interconnected channels with specific markers in the channel. So only one place you need to place the tears, it will flow throughout the channel, and wherever the tear molecules are present, it will be picked up. So a short video to show the workflow. We use tear strips to collect the tears, waiting period of 5 minutes. After that, we collected an Eppendorf tubes. 300 microliters of extraction buffer, phosphate buffer is used. Shaking it well, and the tears are immersed into the tube, centrifuging it to extract the proteins. After that, pipetting out an ml of it and putting it into the test cartridge. As simple as that. Then we put it into the device, which will further read the cytokine levels. As like any lab which is giving us a report, we get like a report like any blood report, which has a normal value. We also have a normative database for the markers. So after these reference intervals, we can see how much the markers are. What application we have to the clinics is that we can have a targeted treatment. We customize the treatment with the available drugs like cyclosporin, trehalose, doxycycline, or the treatments which are coming like the liftigraph and the anti-VEGF treatments for the specific markers. In discussion, I would like to say that this kit is helpful in identifying specific biomarkers and customizing treatment for the patient. What applications we can have in our cataract surgery? We can see that these patients who have post-operative dry eye, discomfort, pain without stain, poor wound healing, we can see the markers for them and diagnose and give a tailored treatment. So what is our way forward? The way forward would be that we have already partnered with Bio-Techne, which is a US-based molecular diagnostic company, which will produce the kit in bulk. And after this, we will send it to all over the country for the future FDA trials. In the future, we have made the kits available for the retinal conditions such as diabetic retinopathy, ROP, and the ongoing tests are done for the myopic progression by searching for the dopamine levels. And in the pipeline is also for glaucoma. So what is already known is that incorrigible dry eye or post-operative dry eye treatment is... Then in conclusion, I would like to say that this is the first point of care diagnostic kit which helps us to understand disease pathology, process, and treatment outcomes and provide a personalized bespoke treatment approach. Thank you.
Thank you very much, Dr. Mallika. That was a great presentation. And I'll request Dr. Vinod Arora to please ask her questions.
Yeah, it's a beautiful presentation, nicely presented.
Thank you.
Congratulations on that. I think this concept is almost for the last 10 years there. Can you ask, I mean, it's very important to know the ocular changes,
Yes.
especially when we do the surgery. We end up doing happy surgery, but unhappy patient. I think the role is, they are very important. So
Right.
what sort of biomarkers we are going to know about it, and which biomarkers are more important for him if we consider ocular surface as such?
Yes, sir. So currently what the kit has are those classical biomarkers, which all the international studies and even our studies have shown that IL-6, IL-8, IL-17A, MMP9, LOX, and the VEGF-B, so and TNF-alpha. So these are the biomarkers which we have already put in our cohort just now, and what the kit is telling us at the moment. So these biomarkers are classically involved in the dry eye disease, and for the after PRK there is haze. We can see if they have inflammatory factors such as IL-17, which is high, or MMP9, which is high, which is leading to any collagen changes.
Can you tell us about the importance of these markers individually? Like one is telling you about the inflammation, otherwise dry eye. So what is the importance of these markers?
So, all these markers, what happens that these markers are specific to the disease condition. Like ocular discomfort has classically an increase of IL-17A and VEGF-beta. Degradation of LOX and collagen, which is mostly seen in post-LASIK ectasia or progression of keratoconus, has an increased levels of IL-6 and MMP9. Degradation of collagen also is directed by a decrease in the lysyl oxidase. And also classical condition, which is the neuropathic pain or the pain without stain, has an increased level of IL-17A and increased level of MMP9. So these are the sectors where we can use the molecules to see what a disease is progressing to.
I think it's a very nice talk, and you have beautifully presented all the points.
Thank you, sir.